Hi, my name is Olga Comodina. I'm a speech pathologist based in Albury Wodonga, Australia. I have over 20 years experience as a speech pathologist, and out of those 20 years I have specialised in childhood apraxia of speech for the last 14 years. My experience with childhood apraxia of speech started when I worked at a clinic in Brisbane, Queensland, which specialised in childhood apraxia. And we had a speech therapist from America who was one of the directors at CAS back then, or now it is Apraxia Kids, which is the Apraxia Association of America, come and train each of the therapists individually. So that was my introduction to childhood apraxia of speech, and that's where my love and passion for childhood apraxia of speech started. In the meantime, I have also worked at an organisation which is the largest organisation for autism in Australia, and there I developed some unique skills to be able to differentiate between autism and apraxia, but also to detect motor speech difficulties in children who have autism. So I believe that puts me in a unique position to be able to figure out what part is the apraxia playing, what part is the autism playing, and whether the two are both having an impact on a child's communication. So the point I'm at the moment is my children are a little older, and for some reason the last few days, weeks, something's just awakened in me where I wake up feeling excited and motivated to increase awareness of childhood apraxia of speech, particularly in Australia. I have a fair bit of experience with delivering telehealth speech therapy services, and about half of my caseload currently is telehealth. So it's not necessarily that I will only provide services for childhood apraxia of speech in Australia, but I am wanting to especially reach people who live close to me who I would be able to see face to face. This is why I'm starting up this Instagram account and this probably YouTube channel as well, is I just want to find the children that come to me, sometimes at 6, sometimes at 11 years old, and have tried a lot of different therapies that haven't worked for them. I want to find these children, preferably at 2 to 3 years old, and provide them with the speech therapy that I've been doing for the last 14 years and have had success with every person that I've worked with. Some examples I'll give you is there's a 6-year-old boy. I started to see him at school and he couldn't say mum yet. Within the first session, I could see what was happening with where the speech breakdown was happening, and we got him to say mum, and mum cried in that first session, and he ended up going eventually to a mainstream school setting, and we lost contact. But a few years, many years later, when he was in high school, finishing high school and getting prepared for university, this family reached out to me, and then I supported this student in another way, which was just to prepare for his interview to get into university, which he did successfully. So I would love to find the children out there who are at their beginning stages, but I also am more than happy to work with adults or teens who are in the later stages, not the later stages, but who just haven't found the right therapy that has worked for them. And I hope that you'll join me on this adventure that we are going to embark on together of reaching as many children with childhood apraxia of speech out there at the right time, and helping them find their voice so that we can unlock the level of the syllable that they are having difficulty with, provide the right targeted therapy approach, which usually is the dynamic, temporal and tactile cueing for the early stages, and then get the children through to speaking in sentences and long chunks of speech, and then working on prosody, which is the smoothness and the rhythm and the rate of the speech. So that is the process, and then fine-tuning with the, like the r and the th sounds at the end. That's the process that I'd love to help children to be identified early, to walk them through these steps. And I'm also here to support other speech pathologists, particularly in Australia, who are interested in learning more about childhood apraxia of speech through the videos for free and the content, and also feel free to reach out to me for any individual support as well. I also will just mention that I also speak Serbian and Croatian, so there may be some videos coming out in those languages, and I plan to do a bit of work with some translation of DTTC, dynamic temporal and tactile cueing resources in Serbian and Croatian as well. So if you are from those areas and you would like to reach out to me, feel free to do so. Well, lovely to get out there and make my first post and connect with you all, and I hope you'll join me on this journey if this is an area that you're interested in. I'll speak to you next time. Bye.